I want to turn now to Dr. Ashish Jha. He is the director of the Harvard Global Health Institute. Dr. Jha, good morning. Nice to see you. We heard from the vice president yesterday, doctor. He said that we have slowed the spread, we have flattened the curve. But let me put up a graphic right now, and it tells a very different story. It shows the European Union. That's the black graph, the bell curve that dips way down. And the blue one that sort of rises and then plateaus and goes up, that's the United States. 26 states in the U.S. are seeing an increase in the number of cases right now. Over the last 3 days, we had our three highest totals of cases. So help us diagnose the problem. Why is this happening here right now?
So good morning, and thank you for having me on. This is happening because in much of the country around Memorial Day and the weeks that followed, we opened up while we still had a large number of cases. We didn't have the kind of testing and tracing infrastructure we needed that many European countries have built in. And then we opened up too fast. We opened up bars, we opened up nightclubs. And it's the combination of all of that that has led us to where we are today.
And Dr. Jha, we've spent the past 4 months largely on shutdown. And I think the question a lot of people have this morning is, was that all for nothing? And are we going to have to shut down again?
Yeah, so this is so frustrating because the shutdown was so painful. Millions of Americans lost jobs, kids were at home. And many of us, most of us in the public health community were saying we have to use this time wisely. We have to get our number of cases down. We have to build up the testing and tracing infrastructure we need. We've got to get ready for opening up, because if we don't, we're going to be forced with the kinds of decisions we're seeing again. So I'm very worried we wasted that time as a country, as political leaders, didn't do what needed to be done, and we're finding ourselves in a difficult situation again.
And Dr. Jha, the NBA, Major League Baseball, now announcing their plans to get their season started again. The NBA in particular is going to be doing it in Florida, where just yesterday they saw nearly 9,000 new cases there. Is it likely that these seasons can take place? The NBA reporting 16 players just tested positive, or are they going to have to reconsider?
Yeah, NBA, Major League Baseball, all of the sports have been really working hard to develop plans for how to play safely. And one of the points that I have made to those officials and to the public is that they only can do this if they're in a community that isn't having large outbreaks. Because if they're in a place like Florida where there are large outbreaks happening, then it's going to be very, very hard to bubble off everybody and make sure no one is infected. And, we don't know the long-term consequences of these infections, even in young people. And so if I'm an NBA player and I get infected, I'd be very worried about what that means for the long-term longevity of my health. And so I think what is happening now is really risky for these sports teams. They really have to be thinking about whether they want to be located in a place with far less cases than what's happening in Florida, Texas, and elsewhere.
Again, the U.S. setting records over the last 3 days, our highest totals of coronavirus cases. Dr. Ashish Jha, we appreciate your expertise and your time. Thank you.